Hi, I'm Vivian Williams with headlines from the Mayo Clinic News Network. Here's news all patients with rheumatoid arthritis should hear. RA patients are twice as likely to develop heart problems than the average person. So, RA patients need stepped-up prevention. Research by Mayo Clinic and others has found that standard heart disease risk assessment tools may underrate the danger a particular person faces. So, an international team created a heart disease risk calculator tailored to rheumatoid arthritis. It's called the Transatlantic Cardiovascular Risk Calculator for RA, and it can predict chances of developing heart disease within 10 years. Experts say it's important to know that having RA increases your risk, so talk to your doctor about a plan to reduce it. And in other news, 75 years ago, on July 4th, 1939, baseball legend Lou Gehrig delivered the famous speech bidding farewell to the ballpark and his fans. 2 weeks before, Gehrig was diagnosed with amyotrophic lateral sclerosis, or ALS, at Mayo Clinic. He died 2 years later. Researchers at Mayo continue to search for ways to treat this deadly disease.
It's caused by degeneration of neurons that live in the spinal cord, the brainstem, and in the brain. And those neurons control the muscles.
Dr. Nathan Staff and his team are using stem cells to hopefully protect those neurons from dying. This clinical research is still new, but the hope is to eventually halt and stop the progression of ALS. And now let's talk about lungs. If you're told you have a lung nodule, it can be scary because they can be cancerous, but most of the time they're not. In fact, Mayo Clinic experts say lung nodules are pretty common and are often caused by previous infections and usually don't require treatment. If a lung nodule is new or has changed in size, shape, or appearance, your doctor may recommend further testing, such as a CT scan or tissue biopsy, to determine if it is cancerous. And that's a look at headlines from the Mayo Clinic News Network. I'm Vivian Williams.